Oops, sorry about that. During the hospital treatment, the physician examines the patient and then they write the medication order on the patient's medical chart. That's also known as medication administration, patient's chart, or simply just known as the chart. So the physician's initial order is an admission order, usually written while the patient's either in the emergency department or if they've just been admitted. So I'm going to reduce this screen for a moment and bring that order up so it's a little bit easier to see. Go ahead and stop that. And we're going to look at the order. So here we have an order, an admission order. So the information that's similar for the community and the hospital, the patient's name. The patient in a hospital will be given an ID number. Let's see if I can highlight. We'll just leave that off. Their date of birth needs to be given. Their location in the hospital, what room number that they're in. Their admitting physician, who their doctor is. I don't know why I have, oh, I know. It's because it's a picture. It won't let me highlight. So on here, there's two sets of orders. So when the patient comes in, they're admitted. Their height and weight is noted. When that's entered into the computer, whether it's entered in the household measure of 5 foot 3 inches, weight 251, now that is incomplete, right? So what is missing when it comes to that part listing the weight? Okay, next we see diagnosis. So the initial L for left leg DVT with Fe deficient anemia. So I'm going to ask you a couple of questions about what that actually means. The patient's activities are also listed. They have bed rest with bedside commode, and then after 24 hours they can get up as they wish. That's what then ad lib means. They have a specific diet that's been ordered. That's a cardiac diet. Allergies, NKDA means what? Okay, so the difference between NKDA and NKA. NKDA is no known drug allergies, where NKA means no known allergies. So knowing specifically that if they're allergic to drugs just tells us the NKDA. It's supposed to imply no known allergies would be that we've addressed drugs as well as food and other items. Continuing on with the order, they're being admitted to the medicine floor, or what we usually refer to as med-surg, by Dr. Gyllenhaal. I don't know. I can't read it. Their condition is stable. Their vitals have been ordered, so the nurse is going to check their blood pressure and their temperature and their pulse rate per the hospital protocol routine. The labs that have been ordered, PT and INR every morning, so those are coagulation labs. Call with the results to the physician. A guac stool, so they're going to check to see if there's bleeding in their stool, ×3. And then they're going to check their iron levels in their next lab draw. The medication ordered is IV fluids, or actually for their IV, it's ordered in HL. So that means a Heplock, flush every shift. So they're just securing an IV portal. They're not actually going to hang an IV bag, but they want to have that available for injection. The medications that are ordered for this patient, Lovenox, 1 milligram per kilogram subcutaneous every 12 hours. That's to help with the blood clot. What class of drug is Lovenox? The next drug is Coumadin, 10 milligrams, taken orally tonight, and then for 6 doses. ferrous, epitinic, which is iron, 150 milligrams by mouth twice a day. Vicodin, 1 to 2 by mouth every 6 hours as needed. Now, these orders, this book is written a few years back, and since its printing, there have been some significant changes in what can be written on an order. So, like in retail, when you have an order that's written PRN, the physician has to say specifically for pain and for what kind of pain. So that's missing in here. Colace, 100 milligrams by mouth twice a day. Hold if the patient has a loose stool. Why would that be? What kind of drug is Colace? LOC, PRN. LOC stands for laxative of choice. So if Colace is a laxative, but things aren't moving well enough and the patient wants to have another laxative to try to keep things moving, they can pick something else. Benadryl. Again, with that, I'm sorry, I'm going back to the LOC. With that PRN, it should say specifically if constipated or a frequency. The next orders for Benadryl, 50 milligrams by mouth at bedtime if a patient's having a hard time sleeping. So in this case, it's being used for its side effect of having that sedation or drowsiness component. Call per acute changes, and there's a nutritional consult to put the patient on a vitamin K diet. So on this order, admission order, there's actually no real IV orders that the pharmacy will be filling. They are all cart fill type of orders. So that's just an example. The other thing that has to be on the order is the doctor's signature and the date the order was written, as well as the hospital information. All right, let's go back to our slides. Now, the different kinds of orders, if applicable, the admission order includes a list of medications, dosage, and intervals. Now, some of these medications may be listed that meds that they're taking at home. So that list of medications may not be something that the doctor ordered, but might be their home meds. A lot of times on admit, a physician will continue their home meds. Now, sometimes they'll have them stop. So if that patient came in bleeding, instead of having a blood clot, they might stop the heparin or the Lovenox, the low molecular weight heparin, and or the Coumadin until that coagulation was back under control. Every time a physician examines a patient, new orders or changes to existing orders are usually written. These are commonly referred to as daily orders. So let's look at a set of daily orders. So again, we have what's called the addressograph, which is the patient information at the top of the screen. The patient's name, ID number, their location, room number, their prescribing physician. You'll note that they don't have any allergies. Their diagnosis is a hernia repair, and the date that the order is written, June 24th, written at 4 p.m. Of course, we know that that should be in what form to be appropriate. Routine orders, patient's height and weight, their condition is stable, their vital signs, and they have a regular diet. So on this order, we notice their pharmacy order. So they're ordered D5 half normal saline with 20 MEQs of KCl per liter to run at 100 milliliters per hour, and they can discontinue when they're able to take fluids orally. Other medications they're taking, meperidine 50 milligrams, given intramuscularly every 3 hours, PRN pain. Again, with the new protocols, it should say what kind of pain, severe pain, breakthrough pain. Vistaril, 25 milligrams IM every 3 hours, usually with the meperidine. Vistaril is an antihistamine, And it helps with some of the itching that can occur with an opiate that's been given intravenously or intramuscularly through an injection. Halcyon, 0.25 milligrams at bedtime as needed. Halcyon is a benzodiazepine, laxative choice. Cefazolin, Cefazolin is Kefsol or Ancef, 1 gram IV piggyback, Q6 hours. Now you notice it's just giving the drug. It's not giving the base solution. We'll talk about more about that in chapter 5. The patient has a wound in their foot, so they're going to lance it or drain it in the morning. And then they're going to call if there is a temperature greater than 101.5, which is usually indicative of an infection, or if their blood pressure goes to above 180 over 100 or below 80 over 60. And Dr. Sun signed it and dated it. So that would be a daily order. And then the next order is what we call standing orders. So standing orders are kind of order sets that are pre-printed. So in certain circumstances for admissions, post-op, post-labor and delivery, chemo protocols, because the orders are always the same or have just a few variables, we'll have an order blank that's already filled out that the doctor would just then select a few specific items. So this person had surgery, and they're going to have their vital signs taken every 2 hours. They're going to be turned every 2 hours to help avoid bed sores. If they need to get up to go to the bathroom, that's okay. Bathroom privileges if they're assisted so that they don't fall. Ambulate means to move with assistance if the patient's able to. They're going to have a heat lamp on their neck. So the standing order was for back. The doctor has crossed that out and inserted neck. Same above here instead of in the morning. So this might have been a very early surgery, so they wanted to get them up walking today. Reinforce their dressing as needed. Once they're no longer nauseous, they can eat. Percocet 1 to 2 every 3 hours PRN pain. Morphine sulfate 10 milligrams or 15 milligrams intramuscularly every 3 hours as needed for severe pain. Restoril, benzodiazepine, uses to help with insomnia. MR means may repeat 1 time. Tylenol 10 grains by mouth every 4 hours as needed if the temperature rises above 100 degrees. Tygan, which is an antiemetic, antihistamine type drug, given every 4 hours as needed for nausea. Pericolase, so that's a laxative, or they can use milk of magnesia. They have laxative of choice. Decadron, 4 milligrams IV, or they can have it orally every 6 hours times 24 hours. So Decadron is dexamethasone, so it's a steroid used for inflammation. After that, they will start a Medrol dose pack for the patient to use at home. The standing order had Tagamet as the order, Cimetidine. It's crossed out. The doctor has ordered for the patient to have Pepcid, famotidine, 20 milligrams IV 1 time instead of the choice with the IV or the PO. They're going to have a catheter, then Ringer's lactated after the nausea subsides. Resume home meds, Prozac after they're no longer nauseous. Date of birth, their height, their weight, their allergies, and their location. And that would be often on what we call an addressograph, which is a pre-printed sticker that we could peel and put onto a set of standing orders. If we have patient orders or MARs, we may have that already imprinted onto those orders in their chart. But often the addressograph is in a sticker form. The doctor's signature and the date. So going back to the slides. So, whoops. There we go. So the daily orders, things change, and then those standing orders or routine orders or the pre-printed orders.